Hello everyone, I hope and I believe you all are doing great. This is Dr. Arya, your pathology faculty. Now we will be studying about the achondroplasia. Okay, from this you will be getting a short note. And also, not in pathology, this topic is very important when you go to your final year now. This will be very important in your pediatrics as well. Okay, so read this topic very carefully. So what is achondroplasia? If I say in the term of layman, then it is the short stature or the dwarfism. Okay, it mainly affects 1 in 25,000 children. Okay, then in this you need to understand the genetic basis of this and the medical complications that the person of achondroplasia, that the child of achondroplasia basically faces. So achondroplasia is a common form of dwarfism due to the genetic mutation. What it does, it basically affects the growth and development. It mainly affects the growth and development of the child. See, in this figure also you are able to appreciate they are of the same age. But one person is dwarf as compared to the other person. One person is dwarf. Okay. What are the causes of achondroplasia? So mainly you have the genetic influence, like there is a mutation of FGFR3 gene. There is a gene called as FGFR3 gene. There is a mutation which affects your bone development. Okay. This is autosomal dominant, and guys, you have to comment it down below. What are the autosomal dominant disorders? You know that. You have to tell me. Okay, I'm not telling you. You have to tell me what are the other autosomal dominant disorders you know. Next, so there is a mutation in FGFR3 gene that we have seen. Okay, they affect the bone growth, which finally leads to the characteristic feature that is dwarfism. If I talk about the symptoms and clinical features, then the person is short stature. Okay, there is disproportion of limb. I will draw a diagram for you actually. Like, you also draw it with me. This is a very bad diagram which I am drawing. My drawing is not good, guys. Like, this is the child. Okay. I'm very bad at drawing. I'm just realizing it right now. Okay, let's see. So there will be like this segment, till this segment, this person is having a normal growth. Okay. Now beyond this, there is short limbs of this person. Above the waist, the portion will be normal. Below the waist, the portion will not be normal. There is a disproportion of the limbs. What are the common complications that can occur? The complications that a person can face, first one is spinal stenosis. Second one, there can be ear infection. Okay, these people are prone to developing a ear infection and sleep apnea. Sleep apnea is very common in people who are obese. Okay, what happens in sleep apnea is whenever they try to sleep, there will be a point where they will not be able to breathe. Okay, as a result of which they will wake up very suddenly, right? Even if they are in deep sleep, they are not able to breathe. It is due to obesity, and for that we use a CPAP. Okay, for that we use CPAP. Next, how will you make a diagnosis? So for the diagnosis, you have to see the physical signs. You have to first see the physical signs. Then what you can do, you have to do the X-rays. You have to do the X-ray. Then you have to do the genetic testing. And also, you can prevent this disease by doing a prenatal diagnosis. That is why you may have heard from your obstetricians that there are some tests which we do trimester wise. Like this test is specific for first trimester, this one for second, and this one for third. So, you can prevent this diseases by doing some tests. So you should be very careful, and you should also advise the patient, right? Next, what are the radiological findings you will be able to see? You will be able to see on X-ray. I am able to appreciate that the long bones are becoming short. The long bones, which were supposed to be long in the person of achondroplasia, these bones are short. And also, there is spinal structural alteration. That I will be able to appreciate. Okay, what is the treatment? For the treatment, see, as such there is no cure for achondroplasia. Okay, like there are some surgeries in which you can just do the lengthening of your bones, right? But it's very costly for people who are not able to afford that kind of surgeries. You know what? There was one person in my locality only, and he was suffering from achondroplasia, and doctors have advised him that you should go for the surgery, but the cost of the surgery is very much, and it's better to live with this disease, right? Rather than, see, there are many of the people who are not able to afford, right? That's the only thing. Then you can give the medical treatment. In the medical treatment, what you will include? We will include that we can give the growth hormone therapy. Next, obviously, one thing that you need to give and you need to keep in mind as a very young budding doctors, you have to give the supportive care to the patient. You have to be empathetic to the patient. You know what is empathy, right? To be in someone's shoes. A doctor should always be empathetic to the patients, right? I have already told you. The medical management, we will give the growth hormone therapy. And rest, I think the pharmacology faculty have covered in details what are the growth hormone therapies that we should give to the patient, right? Next is, what is the multidisciplinary approach? So, genetic counseling is for the family support. Then you have pediatrician for the health monitoring, orthopedicians for the skeletal issues, and hearing evaluation and respiratory monitoring should be there. So these are basically a group of members that are required for you to give the person a proper treatment. Okay. Next, see, people who are having achondroplasia are having a normal life expectancy. Okay, it's not like that after the person crosses a particular amount of age, the person will die. mortality is not that much in this kind of disease, right? So the person can live a normal life. These are the summary points. What are the summary points you need to know? Let's see that achondroplasia is a genetic conditions which affect the growth and development. So the causes is FGFR gene mutation. Symptoms is person will be having this short stature and disproportionate limb. Diagnosis will be based on the clinical evaluation and the genetic testing. For the treatment, you have to give the symptomatic management, and awareness is very much. You have to ask the parents, if possible, please do the prenatal diagnosis, because prevention is better than cure. Okay, you need to remember this. As a doctor, it's your responsibility to counsel the patients. We are done with this chapter. If you are having any sort of doubt, please feel free to ask me. Please feel free to DM me. Thank you so much.